or your kid is diagnosed by adrenal insufficiency, and you know the treatment and how to deal with the condition. Is this enough? No. There is an important information that you should know. What is the reason of having adrenal insufficiency? And this is what I will show you later. This graph I'm showing is from the Journal of Endocrinology and Metabolism. And this is extracted from the clinical guidelines for primary adrenal insufficiency. So as you can see, it is split into two halves. One of them for the newborn who has primary adrenal insufficiency and some of the children and adults, and the other half for all the patients that have primary adrenal insufficiency at the age of over 6 months old. I'll start by the half for all patients over 6 months old. First of all, they will be checked for adrenal antibodies or 21-hydroxylase antibody. So if this is positive, and this is the most common reason for having primary adrenal insufficiency, there will be autoimmune disease or APS1 or APS2, which is the autoimmune polyglandular syndrome. So where the immune system attacks by mistake more than one gland, for example, the adrenal glands causing the adrenal insufficiency and the thyroid, and also the pancreas causing diabetics. If the adrenal antibodies came as negative and the patient is male, it's very important to check the very long chain fatty acids, because the cause for the adrenal insufficiency might be X-linked adrenoleukodystrophy. And if it is negative, so the adrenal glands can be checked by the CT scan or the MRI in order to check if there is any tumor or infection in the adrenal glands. Going to the second part for the infants or the selected children, adults having primary adrenal insufficiency, the first thing is checked is the 17-hydroxyprogesterone. If it comes positive, so then the patient will be diagnosed by congenital adrenal hyperplasia or CAH. If it comes negative, so the genetic syndrome can be a rare CAH, which is called AHC, adrenal hypoplasia congenita. And this one is X-linked, so it is inherited from the mother only. However, the CAH is autosomal recessive inheritance. So means that both parents, the dad and the mom, each of them has a carrier for CAH. However, they don't have any symptoms. But it happens like 25% that every kid they have will have the gene that carries the CAH from each of the father and the mother. But in the case of AHC, it's X-linked, so it is only inherited from the mother. And if this comes as negative, so we will go to idiopathic primary adrenal insufficiency, which means that the reason is unknown, but we should follow all of these paths in order to go to this result.